Are you chronically tired during the day and can't fall asleep or stay asleep at night? What few people know is that a simple mineral could be the key to your sleep problem, namely magnesium. But be careful, the timing of intake is crucial because most at night, our body particularly benefits from the relaxing effect of magnesium on our sleep. In this video, I'll show you what really happens when you take magnesium before bed. You'll not only learn the optimal time to take it, but also why many people make the biggest mistake with evening magnesium intake. And current scientific recommendations show how you can maximize the positive effects of magnesium on your sleep, namely through the right combination with other natural factors. And that you're not alone with sleep problems is shown by this slide here. 56% of Americans say they have some form of sleep issue. In Western Europe, it's 31%. In Japan, it's 23%. And overall in America, 60 million people say they have a chronic sleep disorder. Groups of people who are more often affected are especially women, possibly due to the hormonal system, or older people because melatonin decreases. And then we have people who have psychological impairments where the psychological situation worsens because sleep problems are often associated with depression and anxiety. And then we also have people who tend to suffer from chronic pain or obesity who are also more prone to sleep problems. The process of falling asleep or sleep itself is something very, very fascinating and has really occupied generations of scientists. What happens? We know the sleep hormone melatonin rises. It's produced in darkness around 8 p.m. The body temperature drops slightly. Overall, there's a slowing of heartbeat and breathing, and we have a feeling of relaxation in the muscles, or the muscles relax slightly and loosen. And the big question is, how is it with falling asleep? How does it work exactly? That means we have fragmented thoughts, meaning these thoughts become more dreamlike, logical thinking decreases, we slowly lose the sense of time, the surroundings become more diffuse, and we then notice some physical things. And who doesn't know it? The eyelids become heavy, you can hardly focus, the eyes start to roll, muscle tension suddenly decreases, and then you often have this dramatic muscle twitch, which can sometimes wake us up again when falling asleep, and the heartbeat slows down even more, breathing becomes significantly deeper. And particularly interesting scientifically is this tipping point, exactly the second when sleep begins. And what happens exactly in the second we fall asleep? That's particularly interesting. Our brain switches from its fast beta brainwaves to slow alpha and then theta waves. And it's exactly the moment when we can have very strange experiences. That means bizarre and odd impressions, visual impressions, sometimes downright hallucinations. A few days ago, I dreamed that my daughter was crushed by a ferry at the dock. That, of course, startled me awake, and it was exactly at the moment of falling asleep. And maybe you have those moments too. If you have kids, they suddenly say they're dead tired and then say, at the last moment, Mom, I'm scared, or something like that happens, that we have a weird hallucination that then catapults us back out, so to speak. And then we have to go through the falling asleep process again. Yes, and then we literally lose consciousness. But before we look at the influence of magnesium on this process, a quick request. Please subscribe to the channel. I keep seeing that so many people watch the videos but haven't subscribed to the channel. And it has an advantage for you. YouTube will then suggest the most important videos, not just from my channel, but also from other medical channels. So subscribe to the channel now. And now let's look at magnesium, because there are many studies showing that magnesium can improve sleep quality. One study found that magnesium supplementation significantly improved sleep quality and mood in adults with sleep problems. Another study shows that magnesium can shorten the time it takes to fall asleep in older individuals. We'll look at that again in a moment, and then very importantly, we'll also talk about how it can lead to reduced daytime fatigue. So magnesium can help, and interestingly, especially for women, so you're not as tired during the day. And magnesium can literally influence the brain's communication, meaning the neurotransmitters. We'll look at this in more detail here. You don't have to remember it, but on the channel, we have very interested viewers. That means magnesium blocks the NMDA receptor, which contributes to sleep regulation, and as a GABA agonist, magnesium can improve sleep. Overall, magnesium then regulates the brain's communication, if you want to say, between all the neurotransmitters potentially. That means magnesium can influence and potentially improve sleep, especially in people with sleep disorders or older adults. However, the results are very mixed, and I'll present them to you here. An interesting study examined 3 randomized studies with older adults and found significantly that the older individuals could significantly shorten the time it takes to fall asleep. On average, 17 minutes shorter with magnesium compared to the placebo group. I think this result is fantastic. Saving a quarter of an hour when falling asleep, great result. What also came out of this analysis was that there was an improvement in total sleep time, overall a 16-minute improvement, but unfortunately it wasn't statistically significant. The conclusion from this first study was, yes, the overview confirms something is happening with sleep behavior, but it's not statistically significant enough for doctors to say, please take magnesium, it works 100%. But the result was, because magnesium is cheap, readily available, and basically has almost no side effects except for diarrhea if you take too much, then it's definitely worth a try if you administer it up to 3 times to support insomnia. I'll tell you more about the timing of intake in a moment. Even more interesting is this study here. Nearly 4,000 Americans between 18 and 30 years old, so a much younger patient or affected group, were observed over 30 years. And they looked at, in terms of the study for heart disease, what do they eat and how do they develop. And this result between magnesium and sleep in these younger adults was basically a byproduct. That means they measured magnesium intake in the diet and then at the start of the study showed or documented sleep quality. Then after 7 years and after 20 years, the whole thing was surveyed again, a so-called longitudinal study. And originally, as I said, it was meant to learn something about the arterial risk of coronary arteries. And here we see the results of this study. Please don't be bothered that the amount of magnesium intake was related to 1,000 calories. Why? They simply looked at people with different body weights, checked what they eat during the day, and statistically, they just calculated the magnesium intake based on kilocalories. In short, the people who consumed the most magnesium had the best sleep quality. That means they had a significantly longer sleep duration and rarely less than 7 hours per night. The people who ate the most magnesium, they considered a bunch of factors. Education, do they smoke, do they drink alcohol, are they physically active, what is their body weight, and all these factors had no influence. It was really only about magnesium. Fantastic. The same results were basically reproducible with the sole intake of magnesium. However, they saw a difference in people with depression, so there were also people with depression in this group. It turned out that people with depression did not benefit from this magnesium intake. So that's what the study showed. There was only an improvement in sleep quality in people who didn't have depression. The researchers' conclusion was, yes, magnesium improves sleep quality, also increases sleep duration, and overall magnesium is good because it contributes to a healthy sleep-wake rhythm. And that wasn't all. In the realm of science, we observed that this is also recognized as a health claim, specifically an approved health statement for magnesium. It highlights that magnesium can actually do much more. Essentially, magnesium contributes to reducing daytime fatigue, which can be quite beneficial. Why? Because magnesium is a cofactor for the so-called ATP production. ATP is our universal energy carrier. That means when you eat something and drink something, it all gets broken down into various nutrients. But at the end of the day, the body wants a kind of currency that everyone understands, like the dollar, like the euro here, or like briquette, that every or almost every stove understands a specific energy, an energy building block. You could say this energy building block is called ATP. What you do with it, whether you think with this energy block, hold a cup, walk, run, do sports, whatever, the body can use it in various tissues. And here, magnesium is essentially one of the most important cofactors for this energy production to occur. You know, magnesium is involved in well over 300 different metabolic reactions in the body, and one of the most important is ATP production. Without ATP, we are basically dead as a doornail. Then we already mentioned neurotransmitter regulation. Magnesium can essentially work in the brain here, influencing the function of neurotransmitters that control alertness and fatigue. Then we have the big effect on muscle relaxation, and we also have the oxidative effect. That means magnesium has a protective function against oxidative stress, because oxidative stress is also suspected of increasing fatigue. It seems to be one of the mechanisms. On this slide, we now see the European guideline for the treatment of sleep disorders, and there we see as the first measure we should do a so-called cognitive behavioral therapy if we suffer from sleep disorders, and this is recommended for all age groups. What does that mean? It's just things like keeping regular sleep times, then creating a pleasant sleep environment. It should be dark, a bit cooler, it should be quiet. You must avoid things like caffeine, like alcohol, like heavy meals before going to sleep. Avoid electronic devices at least 1 hour before going to bed, and then do stimulus control. That means you shouldn't watch a horror movie or thriller if you already have problems. The bed is, of course, only for sleeping and intimacy, and we also know that with insomnia, you should get up again after about 20 minutes and only go back to bed when you're tired. So increasing sleep pressure, they call it. Then always go to sleep at the same time. Always make sure you get the same amount of sleep and so on. So these are things, simple things, but you just have to know them, and that's simply called behavioral therapy. You can do breathing exercises, relaxation techniques, cognitive techniques, and so on, push negative thoughts into the background and all these things. We also have sleep medications, and there's a statement about benzodiazepines. Partly also low-dose sedating antidepressants, and then actually melatonin is recommended in the extended release form or in a longer acting form. Unfortunately, it's not described exactly, but as I said, melatonin is recommended here. And for long-term therapy, according to the guideline, you should really carefully check whether you take sleep aids for a longer time or whether you really don't use all these other techniques and methods to find sleep again as much as possible. And while we practice more cognitive behavioral therapy here and any sleep aids for 2021, we find if we look a little further, for example, USA, Johns Hopkins University, Maryland, Baltimore, there we find more specific tips on what else we can do to improve sleep. And what I always like about Johns Hopkins is that they are just open. It is certainly among the top 5, top 10 universities, best universities worldwide, and there they recommend certain drinks. Warm milk can be debated whether it's healthy or not, but they simply say it contains tryptophan. You can also consider 5-hydroxytryptophan, which is something that works well. Also chamomile tea due to the flavonoids it contains, or tart cherry juice because it naturally contains melatonin. We also know, of course, melatonin is found in certain mushrooms. However, I wouldn't recommend that you consume them as mushrooms, simply because you'd have to eat several kilos of them and probably drink a lot of glasses of tart cherry juice. Alcohol is to be avoided, caffeine is to be avoided, everything we just discussed. And then importantly, moderate endurance training improves deep sleep phases, but you should not train at least 2 hours before going to bed. Additionally, there are a few more tips to consider. We'll delve deeper into melatonin shortly, but it's also important to note the ideal sleep temperature, which ranges from 65 to 72 degrees Fahrenheit or 18.5 to 22.2 degrees Celsius. Nowadays, there are even systems available where the sleep temperature is controlled through the mattress, ensuring optimal comfort. These systems cost about $3,000 or so. It works with water heating, water circulates, so a big effort. It is then regulated down or up during the night, depending on what the biorhythm dictates. There are a bunch of influencers who are totally into it. The question is always, do they do it because they get a lot of money for it, or is it actually good? Yes, as I said, a $3,000 expensive purchase. Here are more tips for women in menopause. Naturally, keep the room cooler if hot flashes come. Wear breathable cotton clothing, very important. It's also important to have good bedding where you don't sweat underneath, so no synthetic blankets or anything like that. And then, of course, for the ladies in menopause, an absolutely important secret tip, bioidentical hormone therapy. I've already made several videos on the channel about this. Light is also particularly important. There are studies that the blue light from monitors, TVs, also from phones and so on, can contribute to our falling asleep time being extended. So make sure you activate all these night modes and such on your phones and so on. It shortens the time to fall asleep. It doesn't seem to be scientifically significant that it greatly affects sleep duration. However, what affects sleep duration or sleep intensity are light sources at night. So if you have your eyes closed and there's a small light from a TV, which should be unplugged anyway, or through the blinds, if a little light comes in, we know that sleep is automatically lighter. That's why here the clear recommendation for a sleep mask. What also exists, if you have to get up at night to go to the bathroom, there are night lights. We have some that are in red, they run on batteries, so you're not blinded at all. They automatically turn on near the floor when you walk past them. So make sure your night lights aren't too bright. There are really good solutions now. And what's quite normal is that falling back asleep at night can take up to 30 minutes. So that's normal. Falling back asleep at night takes a bit. I help myself with a melatonin spray when it doesn't work for me. Let's talk a bit more about dosages and melatonin. Melatonin ensures that we eventually fall asleep. It's our sleep hormone, but not only that, it's our overarching messenger that distinguishes between day and night and ensures that we then form the control hormones at night, and during the day, our normal hormones, testosterone, estrogen, and so on, that they are then released by the control hormones, and we basically run in day mode. And melatonin is very, very interesting. You can use melatonin for that. It has the health claim that we can handle jet lag phenomena well or better, and it can shorten the time to fall asleep. So about 10 to 30 minutes before sleep begins, we should take melatonin if you want to use it. From the age of 60, we unfortunately only produce 50% of melatonin. That's why there's a big problem with so many older people having sleep problems. I'm often asked how much melatonin I take. I take between 6 to 8 milligrams of melatonin depending on the day. Then comes the big question, why are there only 1 milligram melatonin packages? That's a legal issue in Germany. That means 1 milligram is allowed. That was changed some time ago. And the big question is then, how do you get to 6 milligrams? Well, by taking 6 tablets. That's my dosage. Yours can be at 1 milligram, yours can be at half a milligram. Most of my patients need about between 3 and 5 milligrams of melatonin. Personally, I chew the melatonin tablets and then add a few sprays with melatonin spray so that it can slowly work through the oral mucosa. So once I use the stomach and once the oral mucosa, you should take magnesium about 1 to 2 hours before going to bed. So it takes a bit to work. So not immediately before sleep. Many people do that wrong, but 1 to 2 hours before sleep. And here, the dosage is also essentially very individual. If you have sleep problems and you're already taking magnesium, say between 300 milligrams, then you should maybe take 150 or 300 milligrams rather later in the evening, but not immediately before going to bed. Thanks for watching. I hope these tips could help you a bit. In my other magnesium-related videos, I frequently encounter feedback stating that it has significantly improved sleep quality. So please share your experience if it worked for you. Furthermore, if you're curious about which magnesium compounds are most effective, I've provided a link to this video for you here. After this video, you can check it out. And I want to thank all the channel viewers and especially, of course, the channel members. Thanks for watching and see you in the next video.